Governor Lee, you've called on Tennesseans to do their part to exercise personal responsibility in the fight against COVID-19. And now again, we join to ask you to do the same, sir. 163 days ago, on July the 6th, more than 39 Tennessee physicians who represent thousands more warned you, Governor Lee, that getting COVID-19 under control would require your leadership. We've asked repeatedly for a mask mandate and other interventions so that Tennesseans can safely go to work, provide for their families, and send their kids to school. But Governor Lee, you've rejected the pleas of your healthcare experts. You've rejected the pleas of President Trump's White House COVID-19 task force, and you've rejected repeated evidence generated from within our own state showing that masks and other safety measures are effective. And instead, you've dumped the burden of leadership on municipalities, individual businesses, teachers, and parents, leaving them to fight this global pandemic on their own. And sir, with all due respect, the result of this fend for yourself approach speaks for itself, unfortunately. According to the COVID-19 Tracking Project, earlier this week, Tennessee ranked first in the nation in new cases per 1 million populace per day, achieving a case rate that is nearly double the national average. As of yesterday, COVID-19 hospitalizations in the state of Tennessee were at an all-time high, over 2,800. As of yesterday, COVID ICU admissions in the state of Tennessee are also at an all-time high, over 700 ICU patients with COVID in the state. Most importantly, COVID deaths in Tennessee for the last 7-day period recently hit an all-time high yesterday at over 530. Who's bearing the brunt of this sorrow? It's rural Tennessee. Rural Tennessee, where mask mandates are not in place, is suffering worse than the larger metro areas where mandates exist. Rural Tennessee, without mask mandates, is accruing 129 new cases per 100,000 populace per day, as compared to just 83 cases per 100,000 populace per day in large metro areas with mask mandates in place. And while these numbers tell a story, they're incredibly sad. They also sound a little sterile. They don't begin to describe the epic human toll that is being paid every day by patients and healthcare workers across the state. I live it as an intensive care unit physician. Just last week, I'll never forget it, I had a sweet elderly man, as I'm dressed in this plastic spacesuit, weep on my shoulders and beg me to help him because he still had things to do, he said. Last week, I witnessed numerous patients calling their loved ones to say goodbye, just in case, as we set up to put them on a ventilator, because you don't know if you're going to come off the vent or not with COVID-19. Can you imagine getting that phone call from your mom or your dad or a grandparent or, God forbid, a child in an intensive care unit? It's happening every day in Tennessee. And when patients do die, despite our best efforts, family members are often left to say goodbye over an iPad. I will forever be haunted by the sound of wailing family members, one in particular, as I hold up an iPad in one hand and hold the dying patient's hand in the other. And so your healthcare workers are not complaining. We're not complaining about the hard work. We are lamenting the seemingly endless but preventable sorrow that Tennesseans are experiencing on a daily basis. While the vaccine gives us hope, we fear that the worst is still ahead based on the large case counts we're currently experiencing. The large case counts will be more logs on the fire in the coming weeks. Will we be able to meet the demand? We're going to try, but resources are not unlimited. There are already examples of the system buckling under the pressure. A colleague of mine, a fellow critical care colleague, Dr. Matt King, recently reported that he received a patient from Kentucky this week, and that outside hospital had looked for an ICU bed across the region from Louisville to Lexington, Cincinnati, Western Virginia, Birmingham, Nashville, all before finally finding an ICU bed in Sumner County, Tennessee. And this experience is being repeated all over the region right now. Tennessee, you deserve better, and we can do better. Governor Lee, you've said time and time again that the only way to manage this crisis is through personal responsibility. But we ask you, sir, Where is your responsibility in this matter? We need you to issue a mask mandate. Mask mandates work. Counties with them are faring better than those without them. And counties without them undermine the progress of those that do make the sacrifice to implement them, generating larger case counts and further stretching hospital capacity. We ask you, sir, to make the Tennessee Pledge stronger by requiring employers to implement it. Requiring businesses to keep people physically spaced and to wear masks. Confidence in businesses and confidence in schools is the way to keep them open and thriving. And finally, sir, we ask you to make sure that our schools and businesses who have the support they need to stay afloat during this financially trying time. The logistics are complicated, but I can tell you the vaccine is needed immediately, right? I mean, so if there's, and I don't know all the reasons that went into the decision for holding that 975 back, but if any of it was to create a rainy day stockpile, let me just tell you, there's a hurricane blowing. We need the vaccine to be administered and distributed as quickly as possible, because really time is potentially lives for frontline providers. Blake, another thing that feels different right now is just the overall mentality to managing this patients. At the beginning of a pandemic, we didn't have any therapeutics. We didn't have a lot of evidence to guide our therapy, and so there was a lot of loss of life that sort of felt inevitable. The loss of life that is happening now is totally preventable. We know how to prevent it. Wear a mask, stay home, wash your hands. And it's devastating and maddening to see the loss of life just increasing, seemingly without end, when we know what to do. And Governor Lee, we respectfully implore you to lead at this time. And we would like for you to, issue a mask mandate, make the Tennessee Pledge stronger by requiring businesses to participate. And let's make sure we support our schools and businesses with financial assistance when necessary. Thank you. I'd just like to close by reiterating a few quick points. Hand hygiene, wearing a mask, and remaining socially distanced are the quick keys to knocking this back in the short term until the vaccine can gain traction. A bedrock value in our state is the belief that we all have a responsibility to each other. We are the volunteer state. We can beat this together, but we need leadership. And so Governor Lee, when you have your COVID briefing tomorrow, I'll hope that you'll speak to how your leadership is going to change in the coming weeks. Please tell us how you're going to keep us safe. Please work with us to defeat COVID-19.